All right. Now, I like to always level with my audience, so I want to let the listeners know that I'll be out next Friday because I'm having an elective surgery, and I stress that elective. You don't have to worry about me. I'm just doing this on my own. I decided to do this, and I just wanted to introduce you to my physician, Dr. Sheila Partridge at Newton-Wellesley Hospital, and basically, I don't want to be a fat bastard anymore. That's what it boils down to. I mean, I could describe it in other ways, but I don't want to be fat. And I've had a tough time with my weight. As you know, I've tried these various diets and various other attempts, lipo, to get rid of the weight, and I just haven't been able to do it. So I'll let first of all, let me introduce you to Dr. Sheila Partridge. She's a great physician, and I like her a lot. And Sheila, thanks, Dr. Partridge. Thanks for being with us here on the Howie Carr Show, and thanks for doing this for me. Can you tell the listeners what's going to happen to me on next Friday?
Well, Howie's getting ready for a laparoscopic sleeve gastrectomy, weight loss surgery. Weight
loss surgery, yeah. And what does that involve?
It's minimally invasive. Small incisions in the abdomen create a very narrow stomach, and it changes the chemistry in your body. And it turns a switch that makes you feel not hungry, for the most part. It's not magic, but it's a tool to help patients lose weight.
And so what it involves is that I will, I won't be able to eat I won't physically be able to eat as much for a long time.
Correct. It's restrictive, but it also has a metabolic change that goes on in your body. So, like I said, the chemistry changes, and it really is something that allows you to even the playing field in terms of weight loss.
Yeah. So what exactly? So when I go in there on Friday, I've been, you've had me on a diet. I've lost a little weight, and now I'm switching over to this. So the blended diet, which just means not much solid food anyway. And I'm getting ready for the actual operation, and so it'll take about 2 hours. And what do you do in the operation, Dr. Partridge?
We create small incisions through the abdominal wall, and using laparoscopic equipment,
What does laparoscopic mean?
Entry into the abdomen. It's actually a misnomer because it means enter into the flank, like kidney area, but the abdominal cavity, really, it designates entrance into the abdominal cavity where all your organs sit.
And then you basically make my stomach smaller.
Yes, we create a long, narrow sleeve out of your stomach, and we cut off 85% of the stomach.
And you do this through a little hole, right? With using cameras, isn't that what laparoscopic is? You don't have you don't have the big incisions that you used to have. It's just little incisions now.
Correct.
Wow, that's wonderful.
So not only will I won't be able to eat as much Kowloons on Tuesdays, but I won't have as much desire to eat Kowloons or pizza or anything, will I?
Well, it's very serious. The first month after surgery, it's all pureed liquid diet, and that lifestyle change that you've been working on and doing beautifully with is something that we hope to help you for the long rest of your life. This weight loss surgery is a tool to help you get healthier, and the lifestyle change and the quality of life improvement is something that is worked on throughout.
I've been going to these meetings too. That's a couple of times. I've left the show at 6 o'clock and let VB handle it for the last hour, and it's been because I've been going to meetings and talking. It's not like a 12-step meeting, but it's sort of like a 12-step meeting.
Mutual support.
Yeah, mutual support. Right. I'm listening to people describe what happened and how much and how much weight they've lost and how it's changed everything for them. And, I'll still be a grumpy old man, on the radio. I'll still be a rotten bastard. It's not going to affect
You'll just be a thin rotten bastard.
That's right. Exactly. That's what I want to be. I just want to be a different person in terms of my weight. I don't want people to look at me. My sitting in that chair yesterday was a guy I went to high school with, and I didn't want, and I knew what he must have been thinking. I'm not that fat, but he was probably thinking, man, Howie must be 100 pounds heavier than when we were in high school, right? I don't want that. Dr.
You want to be
Partridge.
healthier.
Right. I want to be healthier, and I want to look better. You know, I mean, but that's legit, right? That's part of being healthy.
Sure, that's improved quality of life. There are certainly benefits to losing weight that are not just improvement in disease.
What are the other illnesses or issues that can come up if you're very heavy that it would be a good idea to look at bariatric surgery? I know sleep apnea is one of them, and diabetes or a pre-diabetic condition could be one of them. Are there others as well?
Sure. So diabetes is one of the main reasons we do Roux-en-Y gastric bypass or sleeve gastrectomy, but other things like high blood pressure, severe joint disease where joints need to be replaced, those are the top 4 diseases.
I was talking to one of your nurses today. I was doing my last go around at Newton-Wellesley Hospital, and she said the first thing I'm going to notice is that the sleep apnea may go away. I have sleep apnea. I wear a mask. That's another thing.
You broke a tooth with your mask.
Yeah, who wants to wear a mask when they sleep? It's ridiculous. You know, it's not just a nice gesture on behalf of my wife. You know, when you have sleep apnea, you can't. You don't sleep as well. You don't get the deep sleep that you need as a person, right?
That's correct.
And it tends, and when you lose the weight, sleep apnea tends, not 100% guaranteed, but it tends to go away, right?
Yeah, over 85% of patients will have at least significant improvement, if not resolve their sleep apnea.
Wow, I'm looking forward to that. There's so many things I'm looking forward to. I'm not even. You know what? I've gotten used to drinking those power drinks. That doesn't even bother me that much anymore. I didn't think I'd like that, but I'm getting used to it. So, if people are interested in this, Dr. Partridge, what's the website they should visit?
The Newton-Wellesley website, www.nwh.org/weight loss, will bring you to our Center for Weight Loss Surgery.
Yeah, and again, we'll put that on our website too, HowieCarr.show.com, so that you can get there. You can get there very easily. And this isn't for every. You have to go. I've been doing it faster than most people, but it can take months. I mean, this isn't something you can go in and schedule and then get it done the next week or anything like that. It's
correct. It's really not the first thing you try, and it takes a lot of preparation.
It's a big commitment doing this.
Absolutely, for the long rest of your life.
Oh.
Yeah. You got to, and you have to lose weight before you can do it. And some of the people that are at these meetings, they went through it like two, three times. They thought they were close to it, and then they decided not to, or you guys decided that they weren't ready for it. So it's a serious operation, but it's been very successful, and you keep making these advances too. I mean, like this sleeve is a fairly newer procedure, isn't it? It's an upgrade from earlier procedures. Yeah,
it's a first part of a 2-stage procedure that used to be done, but as a standalone procedure, it's relatively recent that we've been using this for an effective weight loss surgery.
Yeah. And so if you've heard, sometimes they have gastric bypasses, like for instance, Chris Christie had a gastric bypass, but now people are moving more into the sleeve, so-called, than.
I think Chris Christie had a laparoscopic band, which is going out of fashion, significantly less. It's not done very much anymore.
It's not effective in the long run. It's what I've read about it. Really, people are finding that it wasn't as effective as what Howie's having done, or the other full surgeries. Is that correct?
And it has no metabolic or chemical change in your body. So
there's no behavior changes really that happen with it.
Well,
chemically.
Correct.
Yeah.
And then if you're not in a program, this is a dedicated program for both before, getting ready, and then after surgery. And
this is covered by a lot of insurance policies, correct?
Correct.
Because it's a step up. I mean, if you lose 50 pounds or more, you're going to be healthier, and you're going to need less medical care going forward.
Yeah, I had a family member do it 4 years ago, very successfully. All the weight has stayed off. He's so much healthier. In fact, it inspired the rest of his family to get into shape, and they're all in shape now, and they all look fabulous. And he said it was the best thing he ever did. He ever did. Yeah,
I'm really looking forward to it, and again, I'll be off on Friday. I hope to be back on Monday. If I can't make it, VB is warming up in the bullpen, And Dr. Partridge, you've been great. Everybody at your practice has been great as well.
Thank you.
And it's just Newton-Wellesley is a great hospital, and it's obviously the closest one to where I live. And it's just a really good place. And I know how hard you guys have been working on this and how much effort you put into it. Give people the address again if they want to get more information about this.
www.nwh.org/weight loss.
Great. Are there any final words of advice you want to give me before I see you on a week from Friday morning?
I would say keep up the great work, and we're going to take great care of you.
Thank you. I start the blended diet tomorrow, so I don't know what I'm going to have for dinner tonight.
The last non-pureed meal, is that what you're saying before your surgery?
Yeah, it is. It is the last non-pureed.
Well, try not to have last hurrah, though.
I know. I know. You don't want to. Yeah, you want that liver. You want that liver about the size of a White Castle dime burger. When I go in there on, I've been reading up on it, Dr. Partridge. Okay, Dr. Sheila Partridge from Newton-Wellesley Hospital. Thanks for being with us. We really appreciate it. And again, I look forward to having you cut me open.
Little incisions.
That's right. 5 little incisions. It was explained to me. It's just 5
tiny
little incisions. I look forward to it. Thank you, Dr. Partridge.